Welcome to my channel. 1. A patient receiving treatment for esophageal varices has a Sangstein-Blakemore tube placed to manage bleeding. The nurse's primary assessment should be to A. Ensure the hemostat is available at the bedside. B. Keep track of fluid administration throughout the shift. C. Frequently evaluate the patient's respiratory status. D. Regularly confirm that the balloon is deflated. The answer is C. Frequently evaluate the patient's respiratory status. 2. A woman reports experiencing persistent gnawing pain in her upper abdomen for several hours following meals. Occasionally, when the pain intensifies, she also experiences vomiting. To determine the cause, specific tests are necessary to exclude A. Stomach cancer. B. Peptic ulcer disease. C. Chronic gastritis. D. Pylorospasm. The answer is B. Peptic ulcer disease. 3. When caring for a client with peptic ulcer disease, the nurse should prioritize the following intervention. A. Helping with the insertion of a Miller-Abbott tube. B. Aiding in the placement of an arterial pressure line. C. Inserting a nasogastric tube. D. Placing an intravenous line. The answer is C. Inserting a nasogastric tube. 4. Radiation therapy is utilized prior to surgery for colon cancer for several reasons. Which of the following is one of those reasons? A. To shrink the tumor. B. To remove cancerous cells. C. To completely cure the cancer. D. To assist in the healing of the bowel post-surgery. The answer is A. To shrink the tumor. 5. Which symptom is a client with colon cancer most likely to show? A. Altered appetite. B. Altered bowel habits. C. Weight gain. D. Elevated body temperature. The answer is B. Altered bowel habits. 6. A client has recently undergone surgery for colon cancer. What potential complications could arise for this client? A. Peritonitis. B. Diverticulosis. C. Partial bowel obstruction. D. Complete bowel obstruction. The answer is A. Peritonitis. 7. A person diagnosed with gastric cancer might show some of these symptoms. A. Stomach cramps. B. Persistent appetite. C. Sensation of fullness. D. Increase in weight. The answer is C. Sensation of fullness. 8. What diagnostic tests can be conducted to check for gastric cancer in a client? A. Barium enema. B. Colonoscopy. C. Gastroscopy. D. Serum chemistry levels. The answer is C. Gastroscopy. 9. A patient diagnosed with gastric cancer is likely to undergo surgery for resection. What should be the top priority for nursing management in the preoperative care of this patient? A. Discharge planning. B. Addressing nutritional deficiencies. C. DVT prevention. D. Education about radiation therapy. The answer is B. Addressing nutritional deficiencies. 10. When providing care for a postoperative patient following gastric resection, attention should be directed towards which of the following concerns? A. Body image. B. Nutritional needs. C. Skincare. D. Spiritual needs. The answer is B. Nutritional needs. 11. What complications from gastric resection should the nurse advise the client to be aware of? A. Constipation. B. Dumping syndrome. C. Gastric spasm. D. Intestinal spasms. The answer is B. Dumping syndrome. 12. A person diagnosed with rectal cancer might show symptoms such as A. A feeling of fullness in the abdomen. B. A sensation of fullness in the stomach. C. Blood in the rectum. D. Pain in the upper right side of the abdomen. The answer is C. Blood in the rectum. 13. Which of the following conditions in a client could increase the likelihood of developing rectal cancer? A. Adenomatous polyps. B. Diverticulitis. C. Hemorrhoids. D. Peptic ulcer disease. The answer is A. Adenomatous polyps. 14. Which of the treatments listed below is specifically used for rectal cancer and not for colon cancer? A. Chemotherapy. B. Colonoscopy. C. Radiation. D. Surgical resection. The answer is C. Radiation. 15. Which of these conditions is most likely to directly lead to peritonitis? A. Gallstones. B. Inflammation of the stomach. C. Perforated ulcer. D. Incarcerated hernia. The answer is C. Perforated ulcer. 16. What symptoms might a client show in the initial stages of peritonitis? A. Swelling in the abdomen. B. Abdominal pain and stiffness. C. Increased bowel sounds. D. Pain in the right upper abdomen. The answer is B. Abdominal pain and stiffness. 17. What laboratory results would you anticipate in a patient diagnosed with peritonitis? A. Partial thromboplastin time exceeding 90 seconds. B. Hemoglobin level lower than 11 mg per deciliter. C. Potassium level greater than 5.8 milliequivalent/L. D. White blood cell count higher than 15,000. The answer is D. White blood cell count higher than 15,000. 18. Which of the following treatments is not part of the medical care for a patient with peritonitis? A. Broad-spectrum antibiotics. B. Electrolyte replacement. C. IV fluids. D. Regular diet. The answer is D. Regular diet. 19. A client diagnosed with irritable bowel syndrome is getting ready to be discharged. What meal plan should the nurse recommend for the client? A. Low fiber, low fat. B. High fiber, low fat. C. Low fiber, high fat. D. High fiber, high fat. The answer is B. High fiber, low fat. 20. What is the primary focus of nursing management for a client suffering from peritonitis? A. Maintaining fluid and electrolyte balance. B. Performing gastric irrigation. C. Managing pain. D. Addressing psychosocial issues. The answer is A. Maintaining fluid and electrolyte balance. Thanks for watching. For more, subscribe the channel at Healthcare Insights.